pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I will now ask Ms. Brenda Grenay, who's sitting in for Teresa today, if she would do the roll call.
Commissioner Matthews?
Here.
Commissioner Hoffmaster?
Here.
Commissioner Houts?
Here.
Commissioner Lyman?
Touche.
One good turn.
Touche.
Just another.
Here.
Commissioner Baker?
Here.
Commissioner Lannis?
You would think that two Germans could be able to pronounce German names a little better than that. So.
I'm actually French. That's my married name.
Oh.
Oh, there you go.
We have 5 members of the board present, 1 absent. Approval of the agenda. The agenda has been presented. There was 1 item missing, but that has been provided now. So I would entertain a motion to approve the agenda as presented.
Make a motion to approve the agenda as presented.
Support. Motion by Commissioner Baker, support by Commissioner Hoffmaster to approve the agenda as presented. Is there any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed? Motion carries. Minutes of the March 23rd, 2023 Board of Health meeting. Those were included in our packet. Anybody have any additions or corrections to those? If not, again, I will entertain a motion to accept those as presented.
So moved. I second, Mr. Chair.
Motion by Commissioner Hoffmaster, second by Commissioner Matthew to accept the minutes of the March 23rd, 2023 Board of Health meeting. Any further discussion? Hearing none, all those in favor say aye. Aye. All those opposed, motion carries. We have a presentation this morning from the area Branch County Commission on Aging Senior Nutrition Program, and I'm going to ask Commissioner Matthew if he would introduce the representative here from Branch County today.
Thank you, Mr. Chairman. So honored. It is my honor and privilege to introduce our distinguished Director of the Commission on Aging, Ms. Amy Duff. She has been a great asset to we, the senior citizens, as well as the other community members. We appreciate her hard work, and this time Director Duff is going to give us a presentation. Mr. Chairman.
Good morning.
Good morning. Good morning.
Can you hear me okay? Okay. So I want to, first of all, thank you for giving me some time on your agenda today. At the Commission on Aging, we were so honored last fall when we were selected by you for the Congregate and Home Delivered Meals contracts. This is an opportunity we've been looking forward to for several years. And now that we've been through 6 months of that contract, I thought it might be good to come back and give you an update on what we've been able to do with that so far. So I provided you with a handout, just a few short points and some graphs on the back. So to start out with, as we stated in our proposal, we did initially contract back with the previous provider for the months of October, November, and December. That allowed us the time that we needed to hire staff, get our license with food license with the health department, get our supplies and equipment around, all of those important things. So they continued for the first 3 months. After that, we took over operating the program ourselves in January of this year. At this time, we have 2 paid staff and 23 volunteers that work in that program. Congregate lunches are served at the Burnside Center in Coldwater on Mondays, Tuesdays, and Thursdays at 11:30. Home delivered happens on the same days. However, those on home delivered get 5 meals a week, so 2 of the meals that they get every week are frozen. And we have contracted out meal production to Milestone Senior Services out of Battle Creek. That was another item that we had put in our proposal as part of our initial planning. So Milestone makes our food and then we serve and distribute it. On the back is information that I thought would be of most interest to you, having to do with how many clients and how many meals we've been doing. So if you look at that top chart, the green, blue, and yellow one, again, the numbers in October, November, December are the numbers that were done by the previous provider, which we had contracted with, so we were reimbursing them for all of those meals. And then the numbers you see in January, February, March are from our service that we've been operating. So if you look at January, for example, the green column shows you home delivered, and you'll see in January we were serving about 75 clients on our home delivered program. And as you move to the right on the graph, you'll see at the end of March, we were serving about 125 clients. So we've had quick and strong growth in that program. The other exciting thing I can tell you about home delivered is that at the end of March, we did not have a wait list. Wait list was a big discussion that we had with regards to this program, and I had told you that our goal was to eliminate the wait list by the end of the first year, and I'm happy to tell you that we were able to do that by the end of the first 6 months. Continuing on that graph, if you look at the blue lines, that is congregate. In January, we had seen a little over 200 different people come in to have lunch at least once. Many of them had lunch several days. And then if you continue down the graph, in March, we saw a little over 250 different people that came in and had lunch at least once in that month. To give you a feel though for what that's like, before lunch came to the Burnside Center, they were averaging about 17 people at a time, so 17 people sitting together to eat. At the end of March, we were averaging 71 people coming in to eat lunch on any given day. So if you've been to the Burnside Center, you know we have a fairly large dining room. What that looks like is all the tables are full. Everybody's sitting with someone. They've perhaps reconnected with an old friend, or they've made new friends from other times at the Burnside Center. So it's busy. We often have the piano playing. We're using real dishes and silverware. It's fun. It's encouraging. And people are joining other activities at the center too. That is a humongous growth. That is better than where I thought we would be right now. We are very, very pleased with that. So then if you look at the bottom graph, the blue and orange one, this one shows you meals. The top row shows restaurant vouchers, the middle congregate meals, and the bottom home delivered. So you'll see for restaurant vouchers, the orange line is the forecasted line. There is no blue line there because we had not specified in our proposal a number of restaurant vouchers that we were planning to do. But that orange line shows you that at this time in our restaurant voucher program, we anticipate that we'll have done 2,800 meals by the end of the fiscal year, so at the end of September. And then in the middle congregate there, that blue line shows you that we had planned on doing about 4,000 congregate meals, and right now we're on track to do about 8,900, so a lot more people there. And then the bottom, home delivered. In our proposal, we had planned to do about 19,000 home delivered meals in our first year. And that orange line shows you the forecast. We expect that we will end at about 24,000 home delivered meals. So again, phenomenal growth in all of those programs. So as we are going through this, one of the things that we've been looking at is how are we doing financially with all of these changes and all of this exciting growth. Right now we anticipate utilizing all of the federal and state grant dollars that are available to us in the contract. We expect it will all be expended. We are under budget though in our planned millage spending. You'll remember we had money in the budget for that. We are still under budget on that, so we still have room for more growth and more people to be added and more meals to be served. So that's just a short overview. I don't want to take too much time in your meeting here, but if anybody has any other questions, I'd be happy to answer them.
Does anybody have any questions for Ms. Dunn?
What exactly is a meal voucher?
So the restaurant vouchers are a coupon they can get. They work at 3 restaurants in Branch County that we have contracted with, which is Broadway Grill in Coldwater, Broadway Grill in Union City, and Mel's Diner in Union City. Those organizations have met the criteria that the state and federal grants require, and they have a special menu that meets the nutrition guidelines for a congregate meal. So once a month, seniors can get 2 coupons, and then they can use them at any 3 of those, at any of those restaurants. The other item I just wanted to plug quick before I go is that I did give you a flyer. If you know of anybody in Branch County that might be interested in volunteering time with our home delivered meals program, we are very much ready for another driver. We use volunteer drivers for our program. They do get mileage reimbursement. It is a very fun volunteer opportunity. It's very fulfilling. We typically set them up so they run the same route, so they get to know the clients get to know them. They really look forward to seeing their driver. And it's very meaningful service because you're bringing food to people who need it. So we are ready for another driver, looking for another volunteer here. So if you know of anybody that might be a good fit for this, please let them know. I've got our nutrition director's name and contact info on the bottom. All right, thank you so much.
John, do you have a question?
Yes, thank you, Mr. Chairman. First of all, I would like to commend Mr. Chairman about Director Duff and the staff, volunteers, and also the directors, new directors as well as the old. They are working together as a team. As in Branch County, those of us who are seniors, a good percentage here. So we depending upon you, this side of the plate. A lack of words. So I wonder, Mr. Chairman, Ms. Duff can provide public some kind of press release or some kind of information, what you are doing, what you have presented today to the public, so they know in the future you may have a financial needs. They won't be surprised what we have been doing, so they are aware of it. So something like that. And
Sounds
again,
good.
I thank you, Director.
All right, thank you.
Thank you, Amy, for coming and presenting this morning, and we're glad to see that those increase in services there to the seniors of Branch County. So,
Thank you.
we will continue on with our agenda, and item number 3 is public comment. This is that opportunity where members of the public can address the Board of Health. We do have rules that we have adopted in our bylaws that allow the public to speak for no more than 3 minutes. And so the podium is open at this time for any member of the public that would wish to address the Board of Health. Seeing no takers, we will move on. Health Officers Report.
Good morning.
Good morning.
So I start right off talking about public health accreditation in Michigan. This week here at Branch Hillsdale St. Joe, we did have accreditors in to look at our programs, talk with our staff, and provide some feedback. This is a slightly different version of public health accreditation in Michigan than what we are used to in the past. They decided, they being the folks at MDHHS and Michigan Public Health Institute, that in cycle 7, which is what this cycle is, that due to the pandemic, just the local health departments just exiting the pandemic, that this accreditation cycle would look more like consultation and education. So it's not what we have experienced in the past, but still has elements of what we are accustomed to. They did have the opportunity, the accreditors, to look at records and make reviews and comments and talk about things that are going well and things that need improvement. So yesterday we wrapped up all of the core ELPHS, or Essential Local Public Health Service programs, and then next week we have our last conversation on quality improvement, and then they will get to work on writing that final report, which I expect will likely not be ready for May, because they have a month to prepare that, so probably will come to your June meeting. So we will make sure that you see that and have that information as soon as it's ready to go. Okay? So that went well. As far as the agency meetings and trainings, wanted to update you that our new emergency preparedness coordinator is hard at work getting our staff up to date with National Incident Management System trainings, or NIMS. Those trainings that all staff are required to have in public health include ICS 100 and ICS 700. ICS stands for Incident Command System. So I think nearly everyone has completed ICS 1 and 700 at this point. We have some staff then that need to go on and take additional ICS courses, and I list those off there. They're 200, 300, 400, and 800. And we're making good progress and getting caught up and getting everybody where they should be so we can respond to public health emergencies. The annual all-staff meeting was last week Friday. The day started at 9 o'clock and wrapped up at 3. We met in the ProMedica conference room, or the old Kmart building here in Coldwater. The focus on this day was to train the staff on what we do as a local health department, because 58% of our staff has less than 4 years with the department. So lots of new people that don't always have any idea what a local health department does. We even, for 1 year of service, have like 28% of our staff have less than 1 year of service. So it's not a number that we're proud of, but it is our reality, and we have to consider how to make sure that all of our staff are aware of what we do, so that as people call or come into our offices, our staff are best suited to be able to respond and properly direct. So that was a good day in Coldwater. Mouth's Day at the Capitol was April 11th. Dr. Lou Borello joined me along with Chris Dewey, our Emergency Preparedness Coordinator. It was a good day. We started off the morning with the county health rankings presentations, moved on to some legislative visits with Representative Cara and Fink. Then we had our Hometown Health Hero Award ceremony, where our CEO at Hillsdale Hospital, J.J. Hodshire, was awarded a Hometown Health Hero Award. And then we wrapped up the day with meetings with Senator Lindsay and Senator Bellino, which it was a good day. We enjoyed very much our visits, and Representative Cara is coming to visit us at the Berger's office. Did I send an email to you about that? It was on my list to do, but it might not have gotten done. I will make sure you know when that is.
Okay.
So that
26th of
you and Commissioner Baker can attend, yeah, if it works in your schedule. But with the conversations we had that day were, public health priorities. If you're in the district, we'd love to see you, give you a tour, have you meet our staff, and Representative Cara has taken us up on that. So, good day. The county health rankings are in your report today. So these are published every year. There is a ranking system. So what they do is they rank all the counties in Michigan 1 through 83, and you can see that at the very top, the red number, Branch County is 57th, Hillsdale 32nd, and St. Joseph 63rd. The one thing I would say about these is that there's very little difference from one county to the next. There's just enough difference, that you have to rank them somehow. So we should be concerned that St. Joe's 63rd, for example, but we shouldn't get too wildly concerned because the difference between Hillsdale and St. Joe isn't tremendous, okay? However, we should be reviewing the indicators for health outcomes and health factors and take that into consideration along with our community health needs assessment when we focus our efforts and the funding and programming that we do. So, okay, I'll just keep going.
Maybe you should build some pickleball.
We're trying, we're working on it.
The community health needs assessment and community health improvement plan are really moving right along. We have a first draft now of the community health needs assessment, and our contractor Marcus Cheatham is working on that community health improvement plan. We are meeting with them this afternoon that will be all wrapped up in June, and we'll bring all the final reports to you for your review. But it has created a lot of good information and excitement in the different communities. The Great Start Collaboratives have helped with some focus groups, and some of our behavioral health have also helped with focus groups. So, good project, and I think we'll have some good information from it. Our testing kiosks continue for now that we have in Coldwater, Sturgis, Centerville, and Three Rivers, but there is somewhat of an unknown on whether or not they will continue beyond that date in May when the public health emergency ends. So, still waiting for some final word from the state on if they're gonna support those. The contractor has told us they're done.
What about the in-person testing that we have here? What will happen with that come May 11th?
They will be able to support that for a while, but I'm not certain how long. So the testing services, so the last time I asked, which has been probably about 3 or 4 weeks ago now from the testing folks at the state, is that they have some funds that will allow them to continue this work for a while. But I know this is all dependent on what happens at the federal level. And just today, driving in, I heard a report that, there's some push to take unexpended COVID dollars back at the federal level. So if that happens, then things change, right? And so I think it's uncertain, is the best way to say it. All right, I do have a strategic plan update for you today, and we put that in new business, so that's all I'll say about that now. Personnel Policy Committee, Teresa and I continue to meet with them. We have now completed or updated the exposure control plan for the agency and are currently working on the chemical hygiene plan. The opioid settlement funds, I need to reach back out to the county administrators and the county chair to see if, where counties are at with that, and I haven't had a chance to do that yet. The annual report is in its final stages, and that will be at your May meeting for you to review. So we'll bring it to Program Policy and Appeals Committee first, and then to full board meeting. The Coldwater office, we had talked to Branch County Maintenance about doing some restroom facility updates. Haven't heard anything more about that at this point. As you know, the parking lot replacement was voted on last month, and we have notified the contractor of that. Don't have a date yet for the start. The contractor that was awarded the bid for the wood wrap in Three Rivers has been notified. These folks do know that their completion date is required by September 30th. And then at Sturgis, that additional space project is moving along. They've started that build out, and it's in process. So I believe that's all I have for you today.
Could you CC us in when you send that off to the administrator and the chair?
Oh, absolutely.
All right, thanks.
Sure. Yep.
I will tell you, there's a concern from at least one commissioner in Hillsdale County that what we're gonna do with the health agency doesn't conflict and double down already on what the substance use disorder and prevention team is doing. So I'll let you reach out to Commissioner Benzing on that and explain to him your full plans for that.
Okay.
I think we're good to see what Bud,
Okay. Thank you.
things we discussed yesterday.
Well, thank you. Any, on that award that Mr. Hodshire got was, I know we had recognized him here locally. He was recognized at the state. How many people were recognized at the state for that?
I can tell you that, but I don't know right at the moment.
Okay.
I would guess around 9, maybe 10 individuals were seen and that's statewide.
Mhm.
So, but it might be less than that if I take off the other, a couple of words that were on there. So, And I think Senator Bellino also presented him with a legislative,
Yeah, proclamation or,
yeah, one of those, yes. Yep.
Okay. Any other questions for the health officer? Okay, moving forward, medical director's report.
Good morning.
Good morning.
My report for the month is in front of you. I would say that on Mouth Day, again, that I did a lot of listening. It was the first time I had done anything like that. So I felt like I was listening more than speaking. But you would be extremely proud of the stand that Chris Dewey and Rebecca took for some of the questioning and where some of the funding was going and why we were doing certain things, and we went right back to the roots of public health. So there were some very good conversations. So sometimes it doesn't feel like public health is high enough on the agenda for some in the political arena. So they tried to bump it up. So it was very nice to sit there and listen to the great background of public health and why we were there. So. I've also attended lots of Zoom phone calls. I was on one this morning. The big things now are the Candida auris, a fungal infection that's traveling around some nursing homes, kind of making its way into people's homes, possibly because of EMS, we don't know. Lots of stuff that we don't know the origin of. The blastomycosis, which we're going to talk about today, the overdoses in Kalamazoo, which we probably all have heard about. So those were overdoses that there was some laced fentanyl in the drugs that people were doing. So that was a scary thing, and it was brought to the attention of the medical director in that county by the ICU doctors that were seeing some odd things. They had 5 or 6 overdoses come into the ER at one time. They were all extremely ill. There were a couple of deaths. So they kind of investigated, and that was a quick investigation, which was great to see, because I'm kind of learning the steps and the people to call in and the resources for things like that. God forbid we have something like that in our counties, which, you know, Calhoun touches, you know, we're right there. So, and if you look at some of our numbers for opioid use and sexually transmitted infections, it's that corridor. So, you know, we're right there. And we have had a few opioid overdoses in Hillsdale County, so that will help, I think, with that conversation with Commissioner Benzing as well. So there have been a few, so we need to kind of look into those too. And the abortion medications have been a topic of discussion as well. So those are, you know, kind of ready to give to pharmacies to give out, and there's been some lawsuits, so that's always a topic of conversation in the public health arena as well. And I'm working on my emergency preparedness, finishing up my 2 spring classes. And I think the rest of the stuff is the same, just kind of watching numbers and our communicable disease numbers as well in our counties. So my educational piece is on blastomycosis, which I never ever thought I'd be talking about because it's extremely rare. But it's actually frightening what happened in Escanaba. It kind of came out of nowhere. Again, the ER started seeing people with strange respiratory symptoms, and then the connection was made that they all work in that paper mill in Escanaba. So that medical director became aware of things and started to intervene and had some epidemiologists come up to that paper mill, and they're still really not sure exactly where it's coming from. So it's a fungal infection. It can be serious, but people can also walk around and have it and not even know. It comes from the blastomycosis fungus, and it's mostly respiratory symptoms, and that fungus comes from the soil. So we see it in Canada, we see it in the United States, and mostly in the fall we will see those infections, and we think it's people disturbing the soil. So probably something with that and the trees that are going to that paper mill, no one knows. There was even a contractor, a guy who picks up paper and delivers, and he got sick. So you're not even spending a lot of time there, but maybe the stuff that got put in his truck to deliver, no one really knows. And death is pretty rare. I mean, There's one study that showed from 1990 to 2010, there were 1,216 deaths, but they've had one in Escanaba, possibly two. That was a phone call I was on this morning, and I didn't quite get to the blastomycosis part, so a little bit scary. And in my opinion, one of those things, you know, while we worry about all of the ongoing things in our counties, this just struck that county out of nowhere. And so we at least need to know our resources and who we can call in and who kind of comes and helps us with those things. So they were shutting down the paper mill. Paper mill was very good about the recommendations from all the groups. They were shutting it down to do duct cleaning and ventilation cleaning and try that process to see if that was helpful. So interesting thing was there were actually workers in the office, in the front office, who ended up with it as well. So it wasn't just people working with the paper and the trees, it was people sitting at the front desk, it was the contractor, it was people that visited. There was a job interviewee that went and spent a couple of hours there. He ended up getting sick, so it's a little bit frightening from a public health perspective and a communicable disease perspective that this happened there. So there is some treatment, it's antifungal treatment and mostly supportive fluids and oxygen and stuff while you're in the hospital, but again, just one of those things that, although rare, and I never ever thought I'd be talking about it, here it is. So we just have to keep our eyes and ears open. And so those opioid overdoses in Calhoun County kind of put me a little on edge as well. So we're kind of watching and we're looking at those numbers, and they had a crew come in and investigate as well. So, and contact with the local community doctors. So in Calhoun County, they were surprised that the ICU doctor called the medical director of the public health department. He said, I don't think that's ever happened before. But thank goodness they had that route of communication, so it's important to kind of keep talking and let people in the area know what's going on around us as well. I think that's all I have this morning.
Any questions for Dr. Luparello? Commissioner Matthew?
Mr. Chairman, I have a question or comment. Commissioner House and I know a few commissioners and others in our Delta County as well as Menominee counties. So I'm concerned about, they have about Upper Peninsula, I believe about 300,000 people live there. And we have a bridge connector. They come to work this side, Lower Peninsula, then they go back. So somehow are you able to obtain some information what happens? People from Menominee counties and Delta counties come to Lower Peninsula and assemble together, then what effect may cause or concern?
Right. As with any communicable disease, right? Travel, we worry about people coming in from other countries, in from the Upper Peninsula to the Lower Peninsula. So the blastomycosis so far have been, like, no one took it home, right? So if I had it and I worked at that paper mill, I didn't give it to my husband. He'd have to breathe in those spores. So there really hasn't been communication like that with blastomycosis, but it's certainly a concern with lots of communicable diseases. You know? And the physician group is kind of watching the numbers, making sure that it kind of sticks in that county. They are seeing people go for healthcare outside of that county, so you have to make counties around you aware that you have this and people might be coming into your ERs. But yeah, definitely. So I can look to just make sure, and if we see things kind of creeping out, we'll let everybody know.
Well, you did sit with them for 2 days.
Yeah, it's a
I'm
little
just-
scary.
Now he's worried for 2
How
days.
big is filtration there, period here?
Choose your friends better, isn't it? And remember, there's, it's, you know, as you said, 300,000 people in UP, there's limited healthcare options.
Right.
People go to Green Bay, or Marquette, and that's where they go for healthcare. Or they come across the bridge, and down.
There's nothing in Escanaba?
There's small there's small little, but, The big ones
Marquette.
are Marquette and Green Bay.
Well, Green Bay is not far from Delta County, so.
No, it's not. That's why they're all Packer fans up there.
Yeah.
Yes.
Next time, stick
Yes.
with the Lord.
Any other questions for Dr. Lucarello? All right, hearing none, moving on. Item 6A, personal health, disease, and prevention.
Good
Ms.
morning.
Nichols.
Good morning.
Well, I am taking a big sigh of relief this morning now that our accreditation is over. Even though we weren't getting the met or not mets, my team worked really, really hard to put all the materials together to have the accreditors come down and review the 6 programs that we have in the clinic. So it was 3 very long days. It was really great to be able to sit down and talk to them about each program. We have several new staff who have never even been through accreditation process, including myself. So it was good to see their faces and meet them and just go through our programs and get that feedback and, you know, talk to them about things that we're struggling with and how they can support us moving forward. So I know we don't have our final review for that yet, but we did get a lot of special recognitions for things that I don't believe we've had in the past. But of course we would have had some not mets too, given the circumstances of the past 3 years and things that really just kind of got dropped. But I just want to give out a shout out to my clinic staff for all the preparation that they did, going through all of the policies and manuals and updating them, so we would be in a good place for when they came down to visit us. Let's see, so it's tick season. MDHS did provide a press release on educating residents about just staying healthy during tick season. So I included several different links in my report that you can view online if you want to take a look at any of those. And it just discusses, you know, clothing, staying out of grassy, bushy areas, make sure that you're checking yourself after coming in, and repellent, making sure your animals and pets are protected as well. One thing that I did see on their website that I thought was pretty cool is that you can either email a picture or mail in a tick if you want to know the identification of it, which I believe Paul said that we have kits here as well if anybody wants to mail a tick in. But it's kind of cool that you can just take a picture of it and send it to them at that website and it can be identified. They won't test for disease agents of the tick though. Because, I mean, even if the tick contains a disease agent, it doesn't mean that you were infected by it, and sometimes negative results can be misleading to people because you could have gotten bitten by a tick that, you know, that you weren't aware of. So it's just something kind of interesting. Marburg disease, I put a little bit about the outbreak that's going on in my report as well, and you can read more information at that link. They do have the Custom and Border Protection going on, but at this time traveler monitoring is optional for us, so we will get notified if somebody was in that area, so we can do a follow-up with them, see if they actually were in an outbreak area, and make sure that people stayed protected well. That's still going on. Let's see.
If we know somebody who's going there, when they come back, just to be honest, how long should we stay away from them?
Well, I think there'd be a lot of factors involved with
Too late.
UP, your vacation.
Put this guy in a bubble.
Yeah, right. Let's see here. There were some updates going on with COVID vaccines. Since the emergency use authorization was amended, there will no longer be monovalent vaccines for Moderna and Pfizer. It will just now all switch over to bivalent vaccines. So there's no more use. We have to discard all monovalent vaccines for COVID. I'm sure we'll have more clinical considerations and updates coming down as the public health emergency.
What are monovalent vaccines?
What's that?
What are
Monovalent.
vaccines?
So that's the vaccines that we had right in the beginning when COVID hit. They were the original one strain vaccines. And then they had the bivalent, which, you know, would target other variants like Omicron and,
Okay.
you know, so Now the primary vaccine is the bivalent, that's been out for quite some time now. And they are discarding the monovalent vaccines, and this will definitely slim down the schedule as to how people receive vaccines, because that's been a really big issue throughout the pandemic, especially in clinical areas, just monitoring all of that, make sure that people are getting the right vaccine, following the correct schedule, age groups, so they're definitely starting to slim that down now. Let's see here, all of our WIC appointments are now offered in person. Public health emergency order ends in May. Once that is over, I believe people have until August to be fully in person, but we don't have to worry about that because all of our programs are back in session, and obviously they still have the remote option until the order is over, but we're all set to go with that, so we won't have any worries with trying to bring people back in, that adjustment period. A couple of staffing issues that we have, well, not really issues, just availability, but we unfortunately do not have a mobile unit RN anymore, and we're losing our clerk. Very sad about that. She found another opportunity, but so we don't have any mobile unit staff at the moment, and then we're also looking for an RN in our Three Rivers office. We have a very seasoned nurse over there, so we're sad to see her go as well, but she's retiring. So we have that posted online, and then we've also had an interpreter position available as well in that office. I think that's all I have for you today. Any questions I'm happy to answer.
Who's leaving Three Rivers?
Rhonda DeBoard, she's one of our public health nurses.
Yes, Commissioner Matthew.
Interpreter, what language or languages?
Spanish.
Thank you.
Yep.
Thank you.
Mr. Chair. Kelly, why would we want to identify ticks again? I know it's a stupid question, probably. I know
no.
we want to know, like, if they have Lyme disease, but is there other reasons for wanting to?
Yeah, there's definitely lots of diseases that people can get that are tick-borne. And I know EH, Paula could probably help speak on that as well, because they do the tick drags to do identification of all different kinds of ticks in the areas. But there's several different diseases that people can get. Anaplasmosis is one that people, did I say that right? Anaplasmosis, okay. That people can get as well. And Lyme always causes people really big issues too. And then most of the time people aren't aware that they were bitten by a tick. There's the bullseye rash that you can get, but sometimes it doesn't present that way. So they don't even know, and they come down with some of these really odd symptoms that they have. So, and then of course your pets, we can't forget about our pets, and I'm thinking about my dog too.
Yeah.
Just some of the illnesses that people can get can be really frightening from tick-borne diseases.
Okay. Where were ticks when I was a kid? I mean, never heard of it. I used to play outdoors in the woods all the time, and now I have ticks. Was ticks around back in the day?
Well,
I'm sorry.
Where were the ticks in the 60s and 70s and when I was a kid?
Good question. Yeah.
They have moved.
John, I would probably tell you that some of the DDT and some of the other things that were maybe used back in those ancient days maybe kept those numbers down, and those have been restricted or outlawed for use now, and so that's maybe why we're seeing more of them resurge in nature.
Even things like bed bugs, right? I mean, we all used to say, don't let the bed bugs bite, right, when you put your kids to bed. But none of us ever saw bed bugs, right? But today, they're bad.
I think there's just more awareness now too. There's a lot of programs like the Vector surveillance program that's funded by the CDC. Those things weren't around back then. And we have sections at the state that are specifically looking at that. So it's just kind of heightened awareness. I think it probably was around and just it never made the news as much. So I think that's all part of it as well.
Ms. Nichol, you said we don't have a mobile unit RN now.
Correct.
How long had she been, that nurse been with us that left? Not long, right?
No, not long at all. I mean, I think it was a matter of weeks.
And the clerk, how long?
Oh, Jody was with us for quite some time. She was maybe around a year or two.
I'd say a couple of years.
I mean, long considering the state that we've been in with, turnover. So,
And you mentioned something earlier talking about, or maybe Dr. Lucarello did, talking about the opioid overdoses up in Kalamazoo. She also mentioned the other communicable disease, and I see chlamydia, we've got an increase in that.
yes, we do. We have St. Joe County, has predominantly the area for us, with a large number of STIs, but I know when you look at the data like that, it's shocking, but that means that people are being tested and they're getting treated. So
Okay.
it's kind of a good thing to see those numbers, because it definitely has always been very prevalent in that area. And that's actually one of the things that I spoke a lot about when we had our creditors come down, and do our STI HIV program on what are some more of the creative ways that we can, get people educated, get them tested, just options on things that we can do to improve that around here, and maybe just spread more awareness and things like that. So they'll be doing a follow-up with us where we'll get to discuss some of those things. But yeah, I just wanted to mention to keep in mind that, the numbers look high, but that's a good thing because people are getting tested and then ultimately hopefully getting treatment after that, for those infections.
Looks like St. Joe again leads the way.
Yes.
Yeah, it's a great thing unless you're a St. Joe County Commissioner sitting right here.
The lack of the mobile unit nurse, how will that affect some of the outreach we do? I know you do some specifically in Branch County with some of the Amish communities down in California Township and that stuff. Will that still continue and we'll just fill another nurse into that unit for some of those things, or?
Yeah, we're gonna have to once again discuss some creative ways how we can get the mobile unit going with just the staffing that we have, which will really be a challenge. Mainly with the Amish population, our Children's Special Health Care has a really good connection with them, so, and they're doing home visits and things like that, so they can get out to the community and everything. But yeah, we're definitely gonna have to, I don't have a solution at this point, honestly. It's something that we're all gonna have to discuss on how we can get it out in the community without having a nurse in that position.
Are we actively recruiting that position, or are we getting applications for the position for the mobile nurse?
Lately, we have not had any come in. Finding nursing staff is very, very, very challenging for us. Especially with COVID, nurses are either moving out of the profession or moved out of the profession, or we just cannot compete with the wages that they get in a hospital setting. So they have to really be in a very different life circumstance to be able to, take a position at the health department, with usually means more flexibility, versus working at a hospital. But the gap between the wages in hospital nursing and public health is very drastic.
Well, and even having a lot of the newer, younger nurses, not even gone to work for hospitals, but gone to work for travel
For sure.
Exactly.
nursing agencies where they're working 6 weeks at one place, moving on to another, and they're really compensated even better than a lot of those local nurses at the local hospitals are.
Right.
Oh, yeah, $100 an hour minimum. No overtimes, no on-calls, no weekends. I mean, it's hurting everybody, the hospitals too.
So, okay. Any other questions? All right.
Thank you.
Thanks,
Thank
Cal.
you. Paul?
Good morning, everyone.
Good morning.
I wanted to start off kind of echoing some of the things that Callie mentioned about accreditation. And as she mentioned, although this wasn't a normal accreditation where we're getting METs or non-METs or met with conditions, we approached it as an agency as if it was. And so there's a lot of stress. Staff worked very hard at it. glad to be past it, and felt that it was very helpful. Meeting with the state folks, the collaboration that we had with them, and we had a lot of discussions about how they can help us, some of the things that we would need from them to help us do our job, and I thought that was very productive. They identified some areas where we needed some work in doing our QA. I knew that was coming, and I knew that we had some areas that we were lacking, and through accreditation I wasn't able to do, never had time to do the QA like we normally did, so some of that stuff kind of fell off a little bit, but I think we have a clear direction now to prepare for the next round of accreditation. And it was encouraging too that the accreditation staff had a lot of very positive things to say about our programs. And then I've been able to pass that along to our staff, and they're very appreciative of that, because day-to-day activities, we don't get a lot of positive feedback necessarily. People don't necessarily, hey, yeah, you're doing a really good job with this. Restaurant owners, hey, yeah, you did a really good job inspecting our restaurant today. Wouldn't necessarily say that. So to have that feedback from the accreditation team in the areas of environmental health was really good, and it helped me to pass that along to my folks, which I was very appreciative of all the work that my staff does. They do a really good job. So. The other thing I wanted to talk about today is give an update on the PFAS, and especially for you, Commissioner Hoffmaster, for the PFAS investigation going on at the West Side landfill. So I think I mentioned last time that they were getting ready to do some testing. They actually identified 9 more homes that they wanted to test. Of those 9 that they identified, they were able to test 8 of those. And of those 8, 2 of them came back with absolutely no PFAS chemicals, which is great. 5, there was actually 6 that had hits for PFAS chemicals. 5 of those were under the health limits. The one that was over the health limit was one that was also tested last year and was over the limit, and they already had a PFAS filter installed in their home. And in that round, they also took a sample through the filter and found that the filter was doing a great job and there was no chemicals whatsoever. So right now, I am working with the plumbing company to get filters for those other 5 homes that tested positive. Even though they're below the health limit, MDHHS has recommended that we get them some filters, because we know there is a high-strength PFAS chemical because of the one exceedance that we had. So whenever that activity is in place, they like to go extra step of being careful to make sure that folks are protected and they have filters in place in their homes. So we still have one home that was identified to be part of the survey, and they to date have not signed an access agreement. So they are still working with that homeowner to get that, and we hope to have that home sampled soon as well. So I will keep you up to date on that.
Remind me, Paul, again, how are those properties identified?
Basically just kind of geographically. So we know the direction of the groundwater flow from where the landfill is, and so they just kind of followed a path along the groundwater flow and identified the homes that are within that direction of groundwater flow. Okay. And they may still expand that even farther out to the northeast at some point, but they're kind of taking it one step at a time.
Yeah.
So the homes that have currently been tested are fairly close to the landfill, off to the northeast. Okay. Along Broadway and Roberts Road, if you're familiar with that area.
Yep. Okay.
So that's the current area. But like I said, they may expand that further. They may even go as far as the next road to the north and try and pick up some homes. There was some talk about that, but that's yet to be determined.
Okay.
Didn't they check like, the county park there? Is that one of them?
That was one that was tested, yeah, yep. And I believe that one came back as negative, so without any chemicals, so that was good.
Mr. Matthews?
Thank you. Mr. Chairman, I have two questions to Director Andriachi. That is, our elected officials, do they know about this situation in St. Joe County?
You know, other than reporting here, Tom, to the Board of Health, I have not reached out to the township officials are aware of this. Yes.
It's my district, so yeah, and Paul's been communicating with me.
Thank you. Mr. Chairman, I suggest that our health officers and Director Andriachi need to have our state senators, state representatives, and of course MDHS, all those. We need to get their phone number, even their personal phone number. This is very important. State senators, Kara and Fink and others. I mean, it can be a serious issue before it becoming serious. We want them to know so they can address for the resources they can provide us with so we can address local. Do you have our local senators and senator and representatives number?
Yeah, I have access to that,
Very
absolutely,
good.
yes.
And we met with them at the day at the Capitol.
Okay.
So, didn't necessarily get down into the weeds of specific issues like PFAS.
Yeah.
But we know how to reach out to them and we'll
Good.
continue to do so.
Yeah, and I guess that would maybe be something that I would stress with Representative Cara when he does come to the office there, is the work that
Right.
you're doing there on that PFAS issue in St. Joe County.
All right, any other questions on the PFAS? Okay,
So-
just one last thing I wanted, yeah.
Still
go
no
ahead.
update on the property in Hillsborough County? Still waiting on
They
that?
have not done anything on that. I actually talked to the gentleman, I'm glad you brought that up, because I talked to the gentleman that works for Eagle, that's working on that project, and they have not made any headway on that. They're having a little bit of difficulty with the homeowner there in getting together and communicating on where exactly they're gonna locate the new well. So that is really kind of at a standstill at this point.
Okay.
Okay, any other questions on the PFAS? If not, I'll just conclude with one last little update. Our last Board of Health meeting, we presented to the board a proposal for a new software system for environmental health, which you graciously passed that. We're very grateful for that. And I just wanted to let you know that we're working with that company very closely and starting to move forward on that. And in fact, we have a kickoff meeting with them a little later today. So we're moving forward. We've got a team assembled within the agency that's going to get this project rolling, and we have a date of August 31st to be up and running with that new system. So
Okay.
that is all I had today. I'd be happy to answer any questions that anybody have.
Couple things. Number one that I've got here is I do appreciate you including the numbers on the septic and well permits and those types of things in our report monthly. I guess I look at that and I, as a county commissioner, I look at that as a potential indicative number as far as economic growth. You know, are we having new wells and septics put in? You know, what's happening in our communities, so I do appreciate that. On your other report regarding the inspections, and I know these are through the month of March, and I think our fee schedule changed, April 1st?
Yes.
Any comment from some of those facilities that are charged those fees on those fee schedule changes, and
We have not heard any comments, negative or positive, as far as, and especially I was concerned about potential negative comments, but no, we have not had any pushback on the fee increases. So I view that as a positive thing, and I think, you know, people that maybe have business in other counties and, you know, do business in other counties besides ours, realize that you're going to other counties, they were paying a lot more for services than they were here. And so I think it's been pretty widely accepted that, you know, we were due for an increase.
And I see you had one food class in March for the management, and that was where, over in St. Joe County? Any others planned coming up?
Yes, we do have some more planned. And one thing that's kind of interesting about the food classes is prior to the pandemic, we almost had to turn people away for the food classes. People really wanted to do it. During the pandemic, when we didn't do the food classes, people found online classes, and I think they've kind of gotten used to that and gone to the online classes, which is unfortunate, because I think there's a real benefit for doing the in-person. But we even had, I think the one that we had in March, we had to postpone that one because we didn't have enough people, and we had to wait till we got more people signed up. So our food staff is really trying to push these food classes and get people to come, because it is beneficial. I think it's much more beneficial to do an in-person class than to do an online class. And, you know, it's helpful for our staff too, because they get to meet the people that are actually working in the restaurants that they're inspecting. And those people get to know our inspectors more of a personal level. And they're not afraid then when the person comes back in to do an inspection to ask them a question about something. Like, oh, you know, sometimes people go, oh my gosh, at the health department, they kind of freak out. But they get to know them more on a personal level. So we are pushing that. But as I said, it seems that people have kind of shied away from that and done the online, because I think more for the convenience of anything else. The online, they can just do it at home. They don't have to go anywhere. They don't have to necessarily take time off of work, because our classes are during the work day. So I think that has affected somewhat the attendance at our classes.
Okay. Any other questions for Paul? All right, moving on.
Thank you.
Thanks, Paul.
Thanks, Paul. Laura?
Good morning.
And-
Good morning.
And I know we have a guest with us this morning as well from the state of Michigan, Bureau of Aging, Community Living, and support, right?
It's a mouthful. Yes, Ashley Ellsworth.
That's Ashley Ellsworth, but yes, so.
Yeah, so thanks for making the trip down, and again, thank you to Amy for coming to deliver the updates that I was thinking about sharing in my report, but it's much more meaningful coming from, you know, an exemplary provider. 6 months in, to see those numbers are pretty wonderful. So thanks again, Amy, for coming. My report included the Services to Victims of Elder Abuse second quarter report. Our numbers are way up. We've served 28 individuals this year, 6 months in, and that was about what we served last year in total. So just this week, we've received multiple referrals over the course of the week, and it's only Thursday, so it's been a very busy time. Court intervention, it's been a very busy time. So Tony is really excited to hopefully find a Branch County, a partner to work on this project with her. And we are still in process, but do have a great candidate that we're looking at. So our St. Joseph County interdisciplinary team just met yesterday. Great attendance, including our prosecutor, who was able to join, and law enforcement was present. So it's always a great discussion, and we have had some good meetings with presentations specifically surrounding adult protective services. And we did have a gentleman come to the Branch County meeting from the Elder Justice Coalition at the state level, which is through Elder Law of Michigan. So he sees all 83 counties' elder abuse prevention efforts, and is you know, comes down to provide updates, and there's some guardianship laws right now that we discussed, so it's been a great couple sets of meetings since our last Board of Health meeting. The advisory committee, again, you know, our bylaws are before you today later in the agenda, so we do appreciate Commissioner Matthew and Commissioner Leininger, your comments and your consideration during the Program Policy and Appeals Committee meeting. Save the date, hope you have May 17th written on your calendar. I'm trying to talk Commissioner Leininger into attending our day at the Capitol with the advocacy platform included, so you can beef up and memorize that before we discuss some of those issues with our legislators.
And I just realized we have a Program Policy and Appeals Committee
We
meeting
do.
that morning.
Yep, and we have area agency business on it, so I will be driving right after the meeting to the Capitol lawn.
You got a ride.
If you'd like a ride, I'd be happy to.
Whether I can make it or not, make sure you get in, if he doesn't come out, make sure you get into the Senate Minority Leader's office and visit with Stephen Reiser. Stephen used to work for Congressman Wahlberg.
Okay.
And he recently took a position with the Michigan Republican Senate caucus, working in the Minority Leader's office for the Senate. Stevens served on the R2AAA board for 7-8 years now.
Okay.
You know, so a very knowledgeable individual on the
Aging network issues.
Aging, yes.
Very good. Thank you for that, and I can name drop your name. It was suggested by Commissioner.
Or he can take you there.
Yeah.
Walk you there.
Yeah,
Or
or you
maybe you
could
don't wanna
introduce me.
name
Perfect. So we'll need to know if you're able to attend, because they're planning for seating and lunches and all those things. They've issued tickets to each region, so we have the opportunity to take 10 people. So I would love to fill all 10 seats if we're able to do that. Our budget amendment process is beginning. We're working with finance and then of course our providers to gain some feedback on what their needs are, how their grant activities have been going, and then what sort of wiggle room we have with any carryover, which is very slim from last year, and where the budget numbers came in with our full year statement of grant award. So those discussions are happening, and we'll have something for you, more to come on that. Monitoring visits will begin in May. We've got that schedule pretty much set with all of our providers, so they're busy preparing documentation, and we are going on site for the first time in 3 years. We can't wait to go see kitchen operations, to take the dietitian with us, to see you know, physical charts and documentation. It'll be much more productive and fun. It's one of the best parts of the job, to learn and to share and have those back and forth conversations. And our planning process has also begun, so hopefully May 8th is marked on your calendar to come to the public hearing. You'll be emailed the draft of the plan very soon, and so I thank you in advance for any time that you might want to ask questions. Certainly I'm available on the phone or through email if you have questions on the plan. But again, no major changes or upheavals to what is going on this year, as nothing is you know, really changing budget-wise or program focus for next year, so won't be any surprises there.
Any questions for Laura? Any comments from Ashley while she's here?
I can provide a couple of updates.
Sure.
Not that Laura didn't cover everything, as she always does, but there's one that you might not even know about.
Oh.
So I'd mentioned in previous meetings, I believe, the interstate funding formula, which that's the funding that comes through us, the state. Sorry again, Ashley Ellsworth, ACLS Bureau, state. So that, there was a recommendation made, there was a presentation to the Commission on Services to Aging. They made a couple of recommendations. It was written up, and so now that's actually out for public comment on our website. Don't ask me, please. I think it's still it's the BP HASA website, which is a whole other mouthful for you, but if you just go to MDHHS, you can go to aging and then find BP HASA, and it's out for public comment through April 30th, so I encourage review of that. The only changes based on the commission's recommendation was there was a 0.5 weight applied to those 85 plus individuals and a 0.5 weight applied to those 60 plus who, and this is their language, speak English less than well. So that was added into the formula that they use to distribute those funds. And this one, that was going to be the surprise for Laura. So as she mentioned, they're currently working on area plans. Last fiscal year, they put together their multi-year plans, which are those 3-year plans. Well, we also just started at the state level working on our state plan on aging, and historically those two aligned so that the objectives from the multi-year plan could reflect those in the state plan. I think this was before I came on, it might have been COVID, but somewhere along the way the multi-year plan got extended, so it kind of fell off that alignment with the state plan. So now discussions are in the works of us trying to realign those, and again, this is very early discussion, so I make no promises, but the talks are happening to potentially extend this multi-year plan. So it's slated to go fiscal year 23 through 25 right now. We would look at extending it through fiscal year 26. The state plan that we're currently drafting right now is fiscal year 24 through 26. Which means that in fiscal year 27, we would start planning, and that's when those plans would potentially align. Again, just from a planning perspective, it makes sense for the area plans, the multi-year plans, to reflect what our state goals are. So those are my 2 updates.
Yeah, we would support that in the network
I-
for sure. I mean,
Yeah.
you know, the more you can align, because they have program development objectives and focus areas, and so the more the state and the local networks are aligned, the better service delivery will be, comments and feedback processes and data, all the droves and droves of demographic data and census tables and all the community needs and things like that, so it would definitely be great. Yeah.
That's all I have.
Thank you.
Thank you.
Any other questions for Laura? If not, Alex. Health, education, and promotion.
Good morning.
Good morning.
This will be quick. Rebecca kind of touched on some of the stuff that I had to update on. I'm very happy to say we finally found a new health educator. I think we've been without one for 2 or 3 months now. She'll be starting May 8th, so that's great. We've been stretched pretty thin, so that's great. Like Rebecca said, we did have our all-staff event on Friday. A lot of what we've been focusing on was planning that and getting that prepared. The feedback we've gotten so far was everyone enjoyed it, so that was the plan and seemed to go well. The annual report is nearly finished. I'm working on revisions, sent it out to directors and supervisors for feedback, probably later today, hopefully. And then, as she mentioned, CHNA, also nearly complete. A lot of things are almost done. I guess that's a good thing, almost done. Lastly, just update from our community health worker. I believe I put the numbers in there. She had a really good month in March. She had like 7 new clients, which was kind of a bounce back from February and January where things slowed down. So I'm very excited for her to just continue building her client load, and you know, we're still working on trying to find a way to keep that program going and find funding past the end of this fiscal year. So that's really all I got. Any questions?
Any questions for Alex? Thank you, Alex.
Thank you.
All right, continuing on. We have committee reports from Board of Health meetings, and I don't believe,
Finance did not meet.
well, but we had minutes from the March 23rd Finance Committee meeting. They were not in the packet. They are online on the website. Because they met before our Board of Health meeting last month, and so we did not have those minutes to approve at that point in time. I hope everybody had a chance to review those on the website. At this time, we will entertain a motion to approve those minutes as they were presented.
So moved.
Second.
Motion by Commissioner Hofmeister, second by Commissioner Baker to approve the Finance Committee meeting minutes from March 23rd. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Next up is the Program Policy and Appeals Committee meeting minutes from April 19th, and those were actually passed out to everybody today. Those were also out on the agency website from that meeting, so I will entertain a motion to approve.
Thank you, Mr. Chairman. I make a motion to approve the April 19, 2023 Board of Health Program Policy and Appeals Committee meeting minutes as presented before us.
Support.
Motion by Commissioner Matthews, support by Commissioner Hofmeister to approve the April 19th, 2023 Program Policy and Appeals Committee meeting minutes. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Next up, Brianna with the financials.
Renee.
Renee. Renee,
Good morning.
French.
the French, yeah.
Good morning. Good morning.
Lisa's unable to be here, but I do, we have the bills here that can be approved and the financials for your review. We are still under budget by 7.63%.
Let's get through the bills first,
Oh, sorry.
and that's all right. So we have before us the bills for the month of March. I would entertain a motion to approve payment of those bills.
So moved.
Second.
Motion by Commissioner Matthews, support by Commissioner Hofmeister, support by Commissioner Baker to approve the March 2023 bills as presented. Any discussion regarding any of those bills? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Next up is the month-end financials for the month of March, and this is where we're under budget.
Yes, here's the financials. We are under budget by 7.63%. I have a list of the ones that, of the programs that are over budget and some explanations. So these are here for your review if you have any questions.
Any questions on the month-end financials? Hearing none, I will entertain a motion to accept the month-end financials for the month of March.
So moved.
I second, Mr. Chairman.
Motion by Commissioner Hofmeister, support by Commissioner Matthews to approve the month-end financials for March. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. New business. Item A, the Area Agency on Agency Advisory Council bylaws update. That was presented in the packet. It was reviewed by the Program Policy and Appeals Committee on the 19th as well, so. Mr. Matthew.
Thank you, Mr. Chairman. By direction of the Program Policy and Appeals Committee, I move the adoption of the resolution presented before us
Second.
Motion by Commissioner Matthews, support by Commissioner Baker to approve the updated bylaws for the advisory council for the area agency on aging. Is there any further discussion?
Mr. Chairman,
Mr. Matthews?
do we need a roll call for that?
I don't believe so.
Thank you.
Any further discussion? Hearing none, all those in favor of approving the updated bylaws, say aye.
Aye.
All those opposed, motion carries. Letter B, Form 5572. This is where Renee's gonna tell us, this is the report on our,
So, pension report.
yeah, on our, pension fund. That this has to be filed, we will later this year have a report from the, MERS. But this is, a report that's gotta be filed with the, before that presentation, so. I will entertain a motion to accept the Form 5572 and file.
So moved.
Second.
Motion by Commissioner Hoffmaster, second by Commissioner Matthew to accept the Form 5572. For Commissioner Baker, as a new member of this board, the agency many years ago closed the defined benefit pension plan to new hires. Still is out there for those that were employed at the time and retirees. And I guess the thing that stood out to me, and forgive me, I didn't look at last year's number, but the nice thing on this is the funded ratio that I saw was 96.3%.
I was actually here early for last month's meeting, so I caught a lot of that, which was very informative.
Yeah, and I said that's very good, I think, for the agency to be that well funded on our pension plan. So, any further discussion regarding the form?
And also last year too, we had, I think it was last year, maybe it was 2 years ago when my first year, we had some unallocated monies
And you
that we
funded it
put
heavy.
towards it, yeah. So,
And-
I think staff's doing a good job of trying to get ahead of that.
And they've added extra contributions, what now, 3 years in a row, I
Yes.
think? So, yes.
COVID money helps us with that.
And the Medicaid cost-based reimbursement,
Yep.
that was the first big influx, were the additional funds that we received for back payment on Medicaid cost-based reimbursement, so.
But essentially, we're caught up with that, right? We don't expect any six-figure payments coming from,
We should get normal payments from that.
yeah, dang it. Okay.
Yeah.
All right. Any further discussion? Hearing none, all those in favor, say aye.
Aye.
All those opposed, motion carries. Item C, strategic plan update. And forgive me, will we need a motion to approve this or just an update on this?
It's an update, I don't think it requires any action. So you'll remember that we came to you back last fall with a strategic plan that you accepted, and it's been about 6 months, so we wanted to give an update on where we stand with that. So this is one of the projects that we've put into our performance management dashboard, VMSG. And so what I will do here is kind of give you just some highlights. But first I want to say that a green traffic light means that we're on target, things are going well. A yellow traffic light indicates that it's coming close to the due date and there should be some action happening there. A gold bar, like you'll see on the bottom of page 52, indicates that that one is complete. And finally, a red traffic light means that we are behind on that one. So what I thought I would do is simply run through the traffic lights that are yellow, red, and gold, if that works.
That does.
Okay, so we'll start with The first yellow traffic light, which is seeking out wage surveys conducted in past 12 months, if available for review, and request the assistance from MELF as appropriate by January of 2023. MELF is updating their salary study in 23. Existing data is from 19. We have collected a recent survey done by Municipal Consulting Services. That actually just came in. It doesn't indicate that here. It says we're in the process of getting ready to get it. But we do have that now. That was done by another local health department in Michigan. So it's a way for us to take that report and look at our report from 19, done by the same company, and kind of see where we stand. So that is in process. We expect to be able to complete this work by the end of June to have relevant data to present to you in October. All right, so moving on then, at the bottom of page 52, you'll see the gold bar, which was, the activity was to analyze agency-wide self-assessment of the public health core competencies to identify knowledge gaps and opportunities for staff development by December of 2022. The survey was completed and the report was received on September 30th. The report has been reviewed. The 3 top training areas identified were stress management, recruitment and retention, and public health 3.0. The 2 core competency skills that scored the lowest are data analytics and assessment skills, and leadership and systems thinking skills. So we have completed that specific activity. Moving on to objective 1.1.3, the activity there with the yellow traffic light, the project is to review each step in the recruitment and hiring orientation process and recommend improvements by March of 23. Steps have been reviewed, but we're still working on the recommendations. So we're slightly behind, but we have started work on that. The next one is a gold bar, and the activity was to develop materials to promote the benefits provided by the agency to be used in the recruiting process by March of 23. Recruitment poster has been created, was reviewed by our personnel policy committee, and it is out there and ready to be used to explain to job seekers the benefits for working at Branch Hillsdale St. Joseph Community Health Agency. The next traffic light to talk about is the one under objective 1.1.4 that's red. Create a multi-department and level employee satisfaction team by January of 2023. We are working on assembling this committee, have sent out multiple calls for staff to volunteer, and are still lacking a complete committee at this point. Certainly hope to begin work shortly, and we will continue to recruit staff for that committee. On the next page, at the top of the page, the activity: maintain a multi-departmental and multi-level staff committee to develop internal communication plan by January of 2023. The committee has been established. It's being led by Josh Engelhardt, who is a health educator, co-chaired by Rachel Wall, who is our community health worker, and then you can see there the other staff members that are a part of that committee. Work on the activity has lagged a bit, but it is ongoing, and the committee has begun meeting. So we expect this to continue to move forward. All right, at the bottom of that page, we have a red traffic light. Develop and disseminate informational materials for the 988 hotline by January of 2023. And that is just something that we need to put time towards. Don't have any other update than that on that at this time. The next traffic light is yellow. The activity is to assess the current behavioral health programs available within the district and share with staff and persons served by January of 2023. That assessment is ongoing. The agency has shared Stay Well resources with our BHSJ team in December as well as November of last year. It doesn't say that anything. Letting them know that these resources are available for clients but can also be used by staff. Oh, yeah, it does say that. We also provided them in November. So we have provided resources to our team. Moving down to the gold bar, the activity there under objective 3.1.1 is to develop and implement timelines to ensure program policy reviews and revisions take place on a scheduled basis by January 23. So this gets right here to the dashboard, which is what this information comes out of. The VMSG dashboard will keep track of the metric to ensure policies are reviewed every year. As policies are loaded into the dashboard, they will have dates assigned, will automatically flag for review after 80% of the year is completed. So this is a great improvement for us. We've always had processes in place to review policies on an annual basis. Especially though during the pandemic, those reviews just were not happening. The performance management system, you know, it provides a reminder and really doesn't allow us to be off the hook, so to speak, on not getting those done. So it'll be a good improvement. All right, the next gold bar is under objective 3.1.2, and the activity is to establish a community health needs assessment team comprised of community partners and staff by January of 23. As we've already reported today, the community health needs assessment is nearly complete. I mean, the report is complete and in draft form at this time. We're working on the CHIP piece of that. The assessment team included myself, Alex Bergmoser, Teresa Fisher, our independent contractor, Marcus Cheatham, staff from the following community partner agencies: the St. Joseph County Human Service Commission, Branch County Collaborative Network, Hillsdale County Human Service Network, Great Start Collaboratives from all 3 counties, and then our community health providers, Lifeways, Pines Behavioral Health, and Pivotal, which is the new name for the St. Joseph County Community Mental Health Department. Finally, we turn the page, and at the bottom we have a yellow traffic light under objective 3.1.3. The project to implement agency-wide educational opportunities on the use of the VMSG software and dashboard functions for program compliance by December of 2022. We have trained about 1/3 of our staff at this point. Training will continue as more work plans are assigned and individuals are named as responsible within the software. The next one is a gold bar, which is to upload the strategic planning objectives into VMSG by December of 2022. And the plan is uploaded, it's being monitored, and that is what you're looking at right now, is the results of that. There is a red traffic light next. Upload program performance measures, at least 3 programs into VMSG by January 23, and quarterly thereafter until all programs are included in the software system. We do have 2 programs loaded into VMSG at this time that are actively being monitored in that system. They are MCH grant, Maternal Child Health grant, as well as the strategic plan, and we are working on loading policies and local accreditation into the system at this time. So we are most of the way there, just slightly lagging on that 3rd program to be loaded in. The yellow traffic light that is next is to monitor the VMSG dashboard on a quarterly basis for program compliance beginning in March of 23. Plans have been added and are being actively monitored, but we are lagging in getting plans added, continuing to get plans added. And that is your update on the strategic plan. If you have any questions, I'd be happy to answer those.
Any questions regarding the strategic plan for Rebecca?
Mr. Chair?
Yes, sir.
I would imagine that implementing the new software programs that you guys are putting together would be a part of that. Is that, I didn't see it, is it in the strategic plan?
You mean like the EH software?
Yeah.
It's not a direct item in our strategic plan, but it could be something that is loaded into VMSG if we want to track it that way. We have not done that yet, but it is something we can talk about doing.
Yeah, well, I don't know if it's useful for you to use or not, but I know it's going to be a pretty big project moving forward.
Absolutely.
Well, I would say that that's probably 1.142.
Yeah, I thought so too.
The create opportunities for staff to express their level of job satisfaction.
Through a better software program.
It's gonna go well, I'm sure of it. Yeah.
You have a system that'll work as opposed to one that doesn't, I think you'll have some better job
Satisfaction will
satisfaction.
increase.
I hope so, I hope so. We do have our kickoff, as Paul mentioned
Yep.
today.
Good,
So,
well, good luck with that.
thank you.
All right, that brings us to item 10 on our agenda, public comment. Again, the public is encouraged to address the Board of Health. Would remind any member of the public that would choose to at this time that there is a 3-minute limit. So the podium is open.
Don? Anything?
Okay. Adjournment. We'll entertain a motion to adjourn.
I make a motion to adjourn.
Look at you. Where have you
I'm
been?
in.
Go, John.
I'm in.
Commissioner Matthews supports. We have a motion from Commissioner House to adjourn, supported by Commissioner Matthew. All those in favor say aye.
Aye.
Aye. All those opposed? Motion passes, meeting adjourned.